Nobody else, yeah. If they move and shake it, we just do it.
Second city, my name's Mally B.
Shake it, Chelsea, do it.
Black people are more likely to die from the coronavirus than white people.
Heard a lot about you, but
There you go, listeners, just giving you an update on what's going on.
DJ Mally B is passionate about music, but he's also passionate about his day job.
I'm actually a complex care nurse. I am part of the frontline team out there in this pandemic.
A frontline children's nurse who has cared for COVID patients and an active member of his local community. Marley says he has huge concerns about today's research from the Office for National Statistics, which shows that black men and women are more likely to die with coronavirus than white people in England and Wales.
People are definitely worried about the figures in the community, and then they're just worried about actually what's happening and what's going on.
But with little data to explain why there's a disparity, Marley warns that some headlines are fueling conspiracy theories in the community. He says the government needs to reach out beyond the mainstream media.
I believe there's a lot of myths going around in the community and online as well regarding this coronavirus.
What kind of things are you seeing?
There's been conspiracy theories happening, things like, again, with ethnicities.
Do you think the government needs to do more to reach certain communities?
I think the people in the local community will tend to listen to their role models in the community more than just mainstream media, which tends to be a lot of repeated information.
The ONS found that when age was taken into account, black people are 4 times more likely to die than their white counterparts. Bangladeshis and Pakistanis 3.5 times more likely to die. The researchers then accounted for other factors, including health, wealth, geography and household composition. They still found that black people are twice as likely to die with coronavirus, and Bangladeshis and Pakistanis more than 1.5 times more likely.
BME groups tend to be disproportionately represented in mental health in terms of outcomes, experience, cancer the same, diabetes, comorbidities, and of course poverty and inequality. It's a complex picture, but some of that picture we've known for some time. It's not a mystery, and it's I suppose it's a tragic episode in a systemic failure, and we have to deal with it systemically.
Tackling those systemic failings will of course take years. In the meantime, the death toll keeps on rising. In the last few days, we've had 3 new pieces of research about the increased risk to BAME communities from coronavirus. The figures have been sobering. So is it now time for a shift in policy towards frontline workers so that we can protect certain groups? There's a concern that there could be a delay because the government has commissioned its own research, which may yet take another month to report back.
While the review and understanding the data is essential, we shouldn't use that as a reason for not taking action now.
Jabir Butt is Chief Executive of the Race Equality Foundation. He's been asked to help the PHE review by engaging with community groups. He says today's data from the ONS is not surprising, given what we already know about race inequalities.
Do you think we were too slow in predicting it?
Well, I think the real issue here is that we've been too slow in acting on it. For example, the clinical guidance that was issued and is still in place doesn't highlight that black and minority ethnic communities are at risk. In fact, it doesn't highlight that men are at greater risk either, which seems deeply problematic. But also the various actions that we should have taken in the interim, whether making sure that communication gets out to communities.
Reaching out to those communities is something Marley B feels he can do now.
I just want to give the NHS staff a massive shout out. And
Public Health England told us tonight that addressing inequalities doesn't rest with one agency, but requires collaborative action at multiple levels of society.